Dr. JP Guidry here. Today we're going to talk a little bit about kind of just the basics of shoulder pain. We'll go into a little bit of the anatomy of the shoulder and then some of the main issues we see and then how we can address that. And then again, I'll put together some exercise demonstration videos to focus on kind of calming down acute pain as well as building back strength, building back resiliency in the shoulder. So the shoulder is another fairly common area that we see people experiencing pain or injury in. Most of these painful conditions, especially in the non-traumatic sense, can still be successfully improved with a conservative exercise and load management based approach. Even when these are kind of muscular tears, rotator cuff tears, labral tears, they can still be managed conservatively without surgery, although surgery is a necessary option sometimes. So if we kind of look at the shoulder, you can see the cursor here. We have the head of the humerus, which is the upper arm bone. This is your bicep tendon, which comes in and attaches into the labrum, into the top of the shoulder, which can get injured itself. You can get some tendonitis, you can get some tearing in there, and it can affect issues with the labrum. Everyone's probably pretty familiar with the rotator cuff. So it's four muscles. We have your supraspinatus. We have your subscapularis. So this is looking at the anterior of the shoulder blade. We have your infraspinatus and then a teres minor, which is not pictured in here. So those four muscles work together. They help create internal and external rotation of the shoulder, and they also help stabilize the humeral head in the shoulder joint when you're moving around, lifting, carrying, things like that. So injuries to this rotator cuff, whether it be inflammation, tendon type injuries, tears, partial or full tears, can lead to pain and dysfunction in the shoulder. You can also get some joint injuries, so the labrum, which is basically kind of the ligamentous or the cartilaginous cup that the head of the humerus sits in, can get injured. You can get some minor or major tears in various areas of that, which we'll talk a little bit about. You can also have osteoarthritis, which you can get in any joint of the body, and you can get some injuries to the AC joint here and to these ligaments here. So we're going to talk mostly about non-traumatic issues and injuries, although falls and things like that can play a part into this. So the most common thing we see in the shoulder tends to be rotator cuff tendon injury, and we'll throw in kind of bursitis with this because it's really hard to kind of separate the two. If it's an inflammatory thing and it's an inflammatory thing, you're going to treat them both kind of generally the same. So the rotator cuff, as I said, is a group of four muscles and their tendons that surround the shoulder joint, that they keep the head of the upper arm bone, the humerus, within the socket of the shoulder. These four muscles are the supraspinatus, infraspinatus, subscapularis, and teres minor. A rotator cuff injury or inflammation, irritation, can cause a dull ache in the shoulder. Generally, you're going to get some more acute, sharp pain when you're moving the arm up or moving the arm away from the body. You may get like a pinching sensation throughout the arc. And so there's various ways it can kind of present. These injuries can be traumatic, so a fall, sports injury, lifting something heavy, pushing, pulling on something heavy. But just as, if not more common, they can be kind of something that develops over time. They can be more common with age. So as those muscles tend to weaken if we're not taking care of ourselves, repetitive use activities, so overhead activities, painters, carpenters, obviously throwing athletes, doing a lot of lifting, those type of things can put stress and can lead to breakdown of those tendons, inflammation of the tendons. Any new activities, so doing something you haven't done in a long time or doing something new that involves excess stress on the area, can lead to inflammatory based issues with there. So again, the common injuries we see are kind of tendonitis, bursitis, which are going to be more your inflammatory issues, You can get some tendon and muscle tears of various degrees, partial and full tears. Obviously, a traumatic dislocation from a fall or from a motor vehicle accident or something like that can lead to injuries in the rotator cuff as well. The good news is many people with rotator cuff injuries and issues can manage those symptoms and return to normal activity with physical therapy, conservative approach, exercise, focusing on range of motion, flexibility, strengthening of the muscles, both of the rotator cuff, the upper extremity itself, the shoulder joint, the chest, the upper back, and load management, managing of activities that aggravate and create pain. Sometimes tears can occur as a result of a single injury, or they can occur as a result of time and repetitive use. In those circumstances, obviously we need a good proper evaluation, but still in a majority of those circumstances, surgery is not necessarily the best or the first option. Second is osteoarthritis. Again, this can happen in any joint of the body. It's kind of a scary term, as we talked about in the knee and the back videos, but it's just a normal part of aging, just as we can get wrinkles and gray hair, and those things don't necessarily cause pain. It affects millions of people. It starts, the process can start in our late 20s and early 30s. And it's just the normal kind of aging of the joints. So it's nothing we're all going to experience if you live long enough. But it doesn't guarantee that you're going to have symptoms or dysfunction from it. There's plenty of people, and there's plenty of evidence of studies showing that, a good portion of people that don't have any symptoms still, when imaged, can present with arthritic changes and loss of cartilage and things like that without having any issues or symptoms. Now, it can definitely cause dysfunction, it can cause pain, but the good news is it can be resolved in a lot of cases without the need for invasive surgeries. And if it gets to the point, just as in other joints, we have joint replacement options that nowadays are getting better and better, and recovery is getting easier, and return to function, pain-free function, is a real possibility if you need to go that route. Next, we have labral injuries. So the labrum is kind of the rim of rubbery cartilage that surrounds the socket and helps hold the head of the humerus in place. It's a shallow, so it's not a very stable rim. It's very shallow. It's thick, it's robust, but a hard enough hit or fall or repetitive kind of stress on it can definitely lead to injury, instability, dislocations. Even traumatic dislocations can cause injuries to it, but it can just kind of lead to an unstable shoulder. So we have a few types of labral injuries that can be of various degrees. So we have a slap tear. That is basically where the front and the back of the top of the labrum comes off. This is where the bicep, we talked about, the long head bicep tendon that comes in the front of the shoulder attaches. That can be affected with that. And so, overhead stuff, throwing, hitting can lead to this. Or just repetitive use overhead work. Traumatic injuries can lead to this. Bankart tears are when, more of a dislocation type injury. So it's where that humerus hits into the labrum, causes a tear. This can leave the shoulder very unstable and easy to dislocate. So sometimes surgery is needed for this. Sometimes it can be managed by strengthening the musculature around it, maybe avoiding certain activities or positions, at least for a while. A superior tear obviously refers to the top of the labrum. A posterior tear refers to the back of the labrum. So symptoms, again, these symptoms can be, confused with a lot of other things. So these aren't a kind of a guarantee. If you have these symptoms, this is what you have. But obviously pain is going to be a big symptom. Generally it's going to be pain in the front of the shoulder. You're going to feel some instability, popping. You may have some, the shoulder kind of moves in and out of the socket, or you have excess movement. Popping, catching, locking, grinding, loss of range of motion, stiffness, guarding, weakness with use of the arm. But again, these can be symptoms of a lot of issues in the shoulder. labrum tears, again, they can be caused by repetitive use issues, or they can be caused by traumatic issues such as falling with your arms outstretched, car accident, overhead type injuries, as well as just a gradual wear and tear of use over the years. Treatment for these, management early on, just like you're going to manage any of these shoulder issues, is going to avoiding or modifying the activities that create pain or that aggravate the shoulder, using ice compression for swelling and pain relief, over-the-counter medications short term can help. The goal as soon as possible to get the shoulder movement, to start to engage the muscles around the shoulder as you can tolerate it, and to minimize the loss of mobility and strength and be able to restore that quicker. So with every approach, we kind of have the same approach, which is phase one is calm things down. So in phase one, we're working on pain control, we're working on restoration of the range of motion as you tolerate it, isometric strengthening and light resisting exercises to the rotator cuff or the shoulder joint itself, as well as the surrounding musculature. Once things start feeling better, pain gets under control, then we want to progress back to more higher level, returning to your normal activities as tolerable, return to more strength building activities, more movement based activities, so overhead pressing, overhead pulling, rowing, chest pressing, carries, while progressing more the isolatory type exercise and movements, but getting back to more like a full body exercise program as well, and then returning to full pain-free strength and function and normal activity as soon as possible. And again, that's the goal with any painful issue we deal with. So the time frames of these things are obviously going to differ from person to person, episode to episode. The degree of injury, the nature of injury and issue are going to dictate that. So we kind of let the pain guide us as we go through that. The goal is to progress to phase two as soon as possible, as soon as tolerable, and back to normal activity. A few notes as we if you look in some of the videos that we'll put in here as well, is don't force any exercises that increase or exacerbate your symptoms. Stay in a comfortable range of motion. Any sets or reps given are just kind of a guide. You can just, based on how you feel, use a resistance that's tolerable but challenging. Work in a set and rep number that's tolerable but challenging. Move slowly and purposeful through each movement as you feel better. Focus on what you feel, how you feel. Focus on doing the movements correctly. I'd rather you do less quality reps than try to force a number. Work to that edge of pain and tension and discomfort, and then back off and slowly try to progress that. As with any of these, pain is not always necessarily related to tissue damage, but tends to be more of a protective response. So just because you have pain doesn't mean you necessarily have damage to a tissue in your shoulder. In the beginning, focus on staying as active as you can while avoiding aggravating or irritating activities and movements. Focus on kind of feel-good stuff, pain-relieving movements and exercises and activities you can tolerate. Once that calms down, the goal is to resume back to normal activities, back to a normal exercise program to restore your strength, your mobility, your function, and your overall health. While it's impossible to eliminate risk of injury or pain, maintaining a good strength, maintaining good health will help minimize those risks and maximize your health and well-being long term. As always, you can reach out to me with any questions. John Paul, JOHNPAUL @GidryPT.com. And look for the videos that we'll put out for the calming down exercises and the building back up.